may be prescribed. Madam Speaker, as a country, we should not have a problem with follow-ups, because just recently, we provided for community health workers in our counties that are being paid. So, Madam Speaker, these are some of the services that they will be providing to our populations. Madam Speaker, Clause 9 talks about services for women with special needs, and Madam Speaker, I already referred to these cohorts of special needs, that we have women who have mental problems, psychological problems, and we must cater for them when they are pregnant, who have needs. They must receive appropriate problems, both acute and chronic, including, Madam Speaker, emotional and learning disorders. So in the case also of pregnant adolescents, Madam Speaker, we must pick them out because we know they are younger people who might not be privy to certain knowledge. This bill spells out the services that are entitled to them. We must provide adolescent-friendly health services. We must provide counseling and anticipatory guidance, Madam Speaker, because we anticipate that being adolescents, they also have peculiar needs that will need peculiar care, Madam Speaker. In the case of women with disability, we must provide disability-friendly services. So, Madam Speaker, this bill spells out the role of two levels of government, the role of the national government, and the role of county governments in their functions in contributing to the health care of maternal, newborn, and child health bill, Madam Speaker. The county governments have the major functions in health. The national governments remains with the standards, the guidelines, collaboration, public participation, monitoring, education, because, Madam Speaker, people need to know some of these services that the maternal, newborn, and child need in this bill. We have in Part 4 a monitoring and evaluation, Madam Speaker, because it would be important that as a country, we are able to pick where these people are. We are able to ensure that these services are given, and where they are not given, then we should be able to make corrections in time. Madam Speaker, this bill talks about the quality assurance, that the Cabinet Secretary shall ensure the implementation and adherence to standards and guidelines in quality in maternal, newborn and child service in our hospitals, in our institutions, in our referrals. There must be quality assurance because, Madam Speaker, that is what will make a difference from what we have been doing in the past. This bill, Madam Speaker, in the general provisions, Madam Speaker, it spells out certain punitive measures. Like in 2A, 24, clause 24, 2A, it spells out that a person offering these services, Madam Speaker, who knowingly contravenes or commits an offense is entitled to some fine not exceeding 500,000, Madam Speaker. And a hospital and an institution, a health facility offering these services also have a punitive clause that spells out a fine not exceeding 1 million or a term of imprisonment if some of those services that are spelled out are not offered, Madam Speaker. Madam Speaker, as I wind up, I want to state that On this bill, the bill it has a statement on how the bill concerns counties. Because health is devolved, Madam Speaker, and as county health services are devolved under paragraph 2 or part 2 of the 4th schedule to the Constitution, county health facilities offer these maternal, newborn, and child care services. And therefore, Madam Speaker, the bill affects the function and powers of county governments. And Madam Speaker, there's a statement that the bill is not a money bill within the meaning of Article 114 of the Constitution. The bill deals with matters other than those listed in the definition of a money bill under Article 114.3 of the Constitution, and Madam Speaker, it is therefore not a money bill within the meaning of Article 114 of the Constitution. Madam Speaker, as I wind up and request, Madam Speaker, just 1 minute so that I call my seconder.
You can proceed to invite the seconder.
Madam Speaker, as I wind up, we should not allow our mothers to continue dying while in the process of securing the continuity of our future generation. And Madam Speaker, I request the Honorable Senator Crystal Asige to second this bill. Thank you, Madam Speaker.
Thank you. Thank you so much, Speaker, for this opportunity to second this bill, which is the Maternal, Newborn and Child Healthcare Bill of 2023. Speaker, I feel very privileged to be able to stand here and second this bill because I am a person that this bill will definitely assist when it comes time for me to make the decision to have a child and to build a family, Speaker. Of course, I understand that I'm not a mother yet, and the mover of this bill actually is one of the biggest encouragers of mine to just start a family, just start a family. When are you starting a family, Asige? And I will tell her today in front of all Kenyans as I second this bill that the reason I haven't started a family of my own is because of personal fears and doubts with my ability and just my readiness to be a mother of a child or children with my disability, which is visual. But also, Speaker, my own fears that are allayed by examples that I have seen myself with women and girls who are pregnant with disabilities and giving birth in our healthcare systems. The atrocious treatment that they get sometimes has scared me out of making this decision to start a family as a young woman with a visual impairment. But I'm glad to be standing and supporting this bill because I know that when enacted, it will help people like me and it will allay some of these fears. The principal objective of the bill is to propose a legal framework, Speaker, through which the delivery of high-quality maternal, newborn, and child health services can be enhanced, addressing the morbidity and mortality among mothers and children, ensuring access to health rights for us, as well as any other matters related to maternal, newborn, and health. It also seeks to provide a platform for raising the profile and for maternal health services, provide a framework for formal engagement, cooperation, and promotion of coordinated approaches to service delivery between the national and the county governments, and enhance accountability and social funding for these health services. A salient feature of this bill, Speaker, is that it highlights the importance of access to quality healthcare and health education by the public, paying special attention to minorities, at-risk people, marginalized communities, and people with special needs. This demographic has historically had extenuating challenges in accessing quality and non-discriminatory maternal and health care. Additionally, Speaker, the inclusion of community-based organizations in interventions will go a long way in making sure that provisions for the maternal, newborn, and child health services are delivered with due sensitivity towards cultures of various communities to ensure adaptability and acceptability, and other reasons that we always see here across the country. According to the latest Kenya Demographic and Health Survey, KDHS, we as a nation currently enjoy decreased mortality rates for children compared to the last 3 decades. This trend shows tremendous progress, Speaker, yet there are still so many things to be done. Kenya's current mortality rate amongst children is 41 deaths per 1,000 live births for under 5-year-olds, and 21 deaths per 1,000 live births for neonates, most of which are preventable causes. With the world average at 38 deaths per 1,000 live births for under 5, and 18 deaths per 1,000 for neonates, there is clearly still a need for targeted interventions for the Ministry of Health to adhere to, as well as relevant state departments to solve. Upon analysis of this bill, Speaker, it's clear that the focus is on interventions meant to bring us closer to the world average, in line with our commitment to Goal 3 of the SDGs, of 21 per 1,000 under 5s and 12 per 1,000 neonates. We, of course, have a long way to go, and we wish for even less than that, Speaker, in future. Hopefully that'll happen through the enactment and the implementation of this bill. Speaker, I would like to bring your attention to some specific provisions that would benefit from clearer definitions or additional information in this bill. And of course, I hope that my sponsor is behind me taking notes. In Section 2, the definition of person with special needs could benefit from the additional of physical and neurodiverse as one of the categories of people with special needs. They are, of course, a particular category of people with disabilities that are not often understood and therefore not often catered for in our legislation. Further, on this note, Speaker, I also request the sponsor to refrain from using the terms persons with special needs and instead use persons with disabilities. That is just in line with the UN CRPD, as well as the African Charter on Disability that we are now, as a constitution, since 2010, have signed to as Kenya, and we are signatories of that. And we need to, of course, be in line with more palatable definitions of persons with disabilities. I also call upon the sponsor to consider adding a section that gives provisions to create a separate mental health wing in all maternal health facilities, especially for women and girls with disabilities, to access and use. This is because, Speaker, women and girls with disabilities require a specialized support in the area of prenatal care, postpartum depression, anxiety, and so on, which, as you can imagine, Speaker, require a very different health service delivery approach, alongside other specially trained medical workers who understand the needs of women and girls with disabilities specifically. In addition to ensuring well-trained medical workers in the care of women and girls with disabilities, Speaker, I also wish to see the sponsor add to the bill a strict requirement that these maternity health facilities provide mobility aids and assistive devices that include, but are not limited to, walking sticks, crutches, walking frames, wheelchairs, hearing aids, screen readers, talking devices, Madam Speaker, healthcare literature, and inaccessible formats, so that all women and girls with disabilities who are using these services are able to understand and be assisted by these devices. Additionally, these facilities across the board must reduce barriers to adequate healthcare by also providing accessible hospital beds, Madam Speaker, as well as disabled toilets, showers and hot baths for women and girls with disabilities, specifically to maintain their dignity. To the sponsor, these provisions must be made in black and white and not assumed, because we know what happens when you assume, Madam Speaker. And it's not parliamentary language, so I can't say it here, but we know what happens when you assume. Next, Speaker, I also want the sponsor to think about what happens to these women and girls with disabilities once they are discharged from the labor ward and sent home with their child, their twins, their triplets, their quadruplets. I want the bill to also provide for trained disability social workers or community health promoters to make frequent visits to the homes of these women and girls and ensure quality home-based care and needs assessments, especially in the formative weeks of the children's lives. It's very important, Madam Speaker, to keep supporting these women, as the sponsor has said, but women and girls with disabilities need specific and nuanced support when they go home with their children. Speaker, recognizing our extenuating mobility and movement challenges in public service vehicles as a barrier, of course, for us with disabilities to seek out these services physically after being discharged is also another reason why. And creating for these provisions for these workers, social workers, to leave the hospitals and visit us directly at home will exponentially improve our response services that could potentially avoid or completely arrest fast deteriorating conditions of newborns that we take home. Early intervention services are desperately lacking in our county, Speaker, and we need to have this provision added into the bill through the sponsor. Section 20, 2D, provides for priority groups, but there is no definition of who these priority groups are, Speaker, in the interpretation section of the bill. This leaves room for ambiguity, as it's open to many interpretations, and I would request for the sponsor to clear this up before the bill comes back to the floor for the next reading, with the express definition provided. In Section 9, the margin note addresses services for women with special needs. In the provisions, Speaker, specifically number 9(1)D, the provision addresses at-risk persons. The note should therefore, in my view, read services for women with disabilities and at-risk persons.
Senator Asige, you have 5 minutes.
Thank you. Next, in the proposed provisions in the maternal, newborn, and child health bill, Speaker, regarding birth attendants, I note the focus on healthcare providers and trained birth attendants. This, for me, unfortunately, excludes traditional birth attendants in our homes and even in our villages in Kenya, who operate without a medical license, but whose expertise and experience are needed to advance the access of safe maternal care, to reach our marginalized communities, and I would also hope the sponsor takes this into account. An additional section in this bill that provides a clear framework should be created, Speaker, that includes the traditional birth attendants to cater to sensitization of their role as healthcare workers. Include them, sponsor, by both national and county governments, and provide an avenue through which these traditional health workers can be registered. Madam Speaker, we can see the doctor strike, and the sponsor has mentioned it. We have seen over 50 children with disabilities die since this has started, because we cannot, as parents and caregivers of our children with disabilities, access healthcare services. We can't access hospital beds. We can't access our service providers. We cannot access therapies, and so on and so forth. And it's a shame when we see mothers and fathers, parents, caregivers, families have to lose their small children with disabilities because of lack of healthcare. Lastly, Speaker, as I finish, a pertinent issue that we need to address is on matters of service delivery and access to health services. In Section 11, specifically H, the national government and county governments are required to put in place measures to facilitate the provision of the infrastructure necessary to support the delivery of basic and comprehensive emergency obstetric and neonatal services. In Section 25, Speaker, number 2, the same governments are obligated to make regulations that prescribe minimum standards for a number of services, of which the above is not included. I propose that such regulations prescribing minimum standards necessary for carrying out functions of this proposed act should also include the provision of the infrastructure necessary to support the delivery of basic and comprehensive emergency obstetrics and neonatal services. Madam Speaker, I want to close there because of time, but I do hope that some of these suggestions and proposals that I've made as I stand up to support and second this bill will be taken into account so that we can ensure both non-disabled women and girls, as well as disabled women and girls, can have the appropriate maternal health care that they deserve so that we can continue also contributing to the growth of this country. I thank you.
Can you second?
Oh, yes, I thank you and I second.
Thank you, Senator Sige. The motion is now ready to be debated, and I'll invite Senator Danson Mungatana. Sorry, before we do that,
put the question.
Senator Danson, I need to propose the question. Honorable Senators, I propose the question that the Maternal, Newborn and Child Health Bill, Senate Bills number 17 of 2023, be now read a second time. I invite Senator Danson Mungatana.
Asante sana Mama Speaker kwa kunipa nafasi na mimi nitoe maoni yangu kuhusu hoja hii ambayo ni sheria mpya inayoletwa na Senator Beatrice, na ninamshukuru sana Senator kwa sababu katika sheria hii ataweka jina lake katika maktaba ya Senate hii na bunge hili na Kenya nzima miaka itakayokuja, ya kwamba alipitisha sheria ambayo ilipatia makingo ya kutosha kwa wakina mama na watoto ambao wanakuja katika nchi hii ya Kenya. Na ningependa sana kumpatia motisha ya kwamba kazi nyingi tunazofanya hapa Senate, Bwana Speaker, Mama Speaker, ni nyingi tunafanya lakini zitasahaulika, lakini sheria ambayo unapitisha hapa kwa bunge katika nakala za Seneti na nakala za Wakenya wazima watakumbuka miaka yote. Kwa hivyo hii kazi umeifanya, najua ni kazi nyingi, lakini nakupa moyo ya kwamba uendelee hivyo hivyo, na ikiwezekana ulete sheria nyingine ambazo zitatusaidia. Kwanza Mama Speaker, ni kusema pole sana kwa wale ambao wamepoteza na maisha yao mkasa ambao tulipata Tana River, na wengi waliokufa katika mkasa wa boti ule ni wamama na watoto ambao walikuwa wanavuka kutoka sehemu ya Madogo wakiwa wanaenda sehemu ya Garissa kwa kazi zao za kawaida. Mama Speaker, majanga yakifanyika, vita vikifanyika, shida ikiingia, wanaoumia zaidi ni wamama na watoto, na tumeyaona haya. Na sheria hii ambayo sasa inazungumzia vipengele ambavyo vinapatia nafasi ya kutunza watoto wanaozaliwa pamoja na mama ambao wanabeba mimba hizi ni sheria muhimu hapa Kenya. Mama Spika, sahihi, na tulikuwa Tana River pamoja na viongozi wa kiserikali wiki hii kuangalia hali ya mafuriko, na tuliona shida kubwa ambayo wananchi wanapata. Wananchi hawana chakula cha kutosha, wananchi wanaumia na mbu siku, mambo ya usalama yameharibika kwa sababu watu wametoka kwa majumba yao ambayo yamezobwa na maji na wamekuja barabarani, lakini hali za kutafuta riziki kila siku zimeharibika. Kwa hivyo watu wanaumia na usalama umezoroteka kwa sababu watu wanafanya uhalifu kupata maisha. Lakini juu ya hayo yote kuna mama ambao wamebeba ujauzito na wanapata shida zaidi. Unaona watoto wadogo ambao mimi mwenyewe, Mama Spika, nikifika nilishindwa tutafanya namna gani. Ndio chakula tumeleta, lakini hawa ni watoto ambao sisi ambao tushakuwa wazazi na tumepitia hiyo stage. Tunajua hawa ni watoto ambao lazima wawe na nguo ya kutosha, mahali pazuri pa kulala. Hawa ni watoto ambao si wa kulala nje kwa sababu usiku baridi ya Tana River pia inakuwa kali. Watoto ambao wanataka lishe bora, watoto ambao wanataka chanjo. Na unaona mama ameshika mtoto, yeye mwenyewe hali zake haziko sawa kwa sababu anatarajia mtoto mwingine, na watoto nao wako na shida. Mimi, Mama Spika, nimefurahi kwa sababu hii sheria imeanza kuweka vipengele vya kisheria ambavyo vinashurutisha serikali za kaunti na serikali kuu kuhakikisha kwamba watoto wetu na wamama wanapewa nafasi ya kuwatunza hawa watoto ili wapate ile matunzo bora ya kiafya. Mama Spika, wakati huu hata tukienda kwa hospitali zetu, mahospitali mengi hawajawapatia wamama ile nafasi ya malezi bora ya wale watoto. Kipengele hichi kinatoa shurutisho ya kwamba yule waziri wa kaunti lazima aweke nafasi na aweke mikakati ya kuhakikisha wamama na watoto wanapata matunzo ya kiafya vizuri katika hospitali zetu. Mama Spika, kule kwetu Tana River sahihi, mbali na zile shida ambazo tuko nazo kwa sababu ya mafuriko, kwa kawaida wamama wetu wanapata shida sana wakati wanaenda kuzaa. Na wengi wao ni kwa sababu hawajapata nafasi ya kutembelea kliniki vile inavyotakikana. Wengi wao hawana lisho bora ambalo linatakikana wakati wa kubeba ujauzito. Wengi wao hawana hela ya kuwatunza. Na wakati wa kuzaa pia unapata kliniki nyingi na hospitali mengi hayana vile vifaa vya kutosha kusaidia mama wetu kule Tana River. Basi mimi nimefurahi kuona hii sheria kwa sababu hii sheria sasa inaelekeza na kusisitiza ya kwamba mawaziri wetu wote wa kaunti, si Tana River peke yake lakini Kenya nzima, ni lazima wahakikishe kwamba watoto wetu na wamama wajawazito wanatunzwa vile vilivyo. Na mimi najua sheria hii ikija ikipitishwa na Seneti, tutapata zaidi manufaa kwa wamama wetu na watoto wetu ambao wanakuja duniani kwa wakati huu. Mama Spika, wengi wetu tulifaidi sana na chanjo ambazo zilikuwa zinatolewa bure serikalini miaka ambayo tulikuwa tu wadogo. Miaka hii imekuwa ni shida kupata hizi chanjo katika county, hospitali zetu za county. Okay.
Senator Mungatana, when we resume the next sitting, you will have a balance of 13 minutes.
Thank you, Madam Speaker.
And regarding certain orders from the order paper, I want to read out the orders that have been deferred and will be rescheduled by Senate Business Committee. Order number 9, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, and 27 are deferred to be rescheduled once again by the Senate Business Committee. Honorable Senators, it's now 6:30 p.m., time to adjourn the Senate. The Senate therefore stands adjourned until Tuesday, 7th May 2024 at 2:30 p.m. Thank you.